Here's a pastime that I think most of us would balk at. Dr. Rebecca Hodes is a medical historian, and I'm told has spent over 3 years collecting waste at public sites around the Eastern Cape. And the findings are fascinating. They reveal a poorly, if at all, regulated sector when it comes to the disposal of waste, and also just how we are medicating ourselves as South Africans. She's standing by for us in Cape Town this morning. Dr. Hodes, good morning to you, and a very warm welcome. You study something called pharma trash, which is rolls off the tongue nicely. I hadn't heard of this before. No one sets out to wander up and down beaches collecting rubbish. What informed your decision to do this? Why is this important?
Jeremy, I was busy doing a large study on HIV-positive teenagers, together with the Department of Health and the universities of UCT and Oxford and a number of partners like UNICEF. And it was punishing work, and often quite sad work, although it was a very resilient group of HIV-positive adolescents. And so I would go on long walks after work, and thoughtful walks, and I would start to have a good look at my environment, often on places like beaches or in the commons, playgrounds, leisure spots. And the more that I looked, the more that I saw nasty things lying around. And while I was working at hospitals, I didn't actually pick up my waste from any of these hospital skips. Rather, it was from pavements outside of clinics or near shebeens or thoroughfares, taxi ranks, schools. People that places live, our normal environments, our commons, and what I found was a lot of pharma trash.
And the danger of this stuff lying around is what?
The danger, it depends. If you've got something like a sharp, something like a needle or a diabetes pen that's been improperly disposed of, then of course you could pierce someone's skin and there's the danger of disease transmission, or something like glass or a razor blade. Those are health hazards. But much more commonplace were pills that had been partly thrown away, or blister packs, for instance, lots of things like nebulizers or plasters, bandages for wounds. And I think what people assumed was that if they threw something in the bin, it was going to a landfill or going to the incineration plant. But actually, rubbish bags are easily split by something like a foil blister pack. And so we live with this waste among ourselves. We live in these domestic environments with waste, even if we've got decent sanitation removal. And so I would visit sites and have a good look at what people were throwing away, not picking out of bins, but just what was lying on the floor. And then often I'd go the day after the rubbish men had come and have a look at what was still lying there in the commons, often on islands of municipal land, outside flats or outside businesses, outside public areas. And these things never left. They were there for many months. And South Africans showed a sort of specific civil disobedience. Often it would be under sites that said things like, do not dump, or no illegal dumping. And there'd be a wonderful, very rich dump sites full of pharma trash. And so those are some of my favorite spots in the research.
So we have a proliferation of medical waste. Patently, we have problems with disposal. Is this simply a poor regulated and badly enforced sector, or is there a degree of incompetence here and people just flouting the rules?
People are certainly flouting the rules, but people don't know what the rules are. And whereas we've made huge advancements, and we just heard from the President on Tuesday about the fact that we've initiated more than 4 million people onto antiretroviral treatment. That's one of the most remarkable public health achievements in history anyway. We've made these medicines available through public health, but sanitation is lagging. And so while the pills might be there, or the diagnostics might be there, or the needles might be there, we don't have sanitation, decent, regulated sanitation systems that can then remove those products or ensure that once they're thrown away, they remain thrown away. They don't wash up on our beaches or end up on our playgrounds. I think, in terms of the medicines that people are taking, there's a great deal of proprietary, that's what we call over-the-counter medicines. Most of the medicines we take are over-the-counter medicines, and people are buying them at places like Clicks or Dis-Chem that have regulated databases. But private pharmacies don't tend to, and the majority of us probably go there because the queues are short if we can afford it, and they do not have single databases. So There's a lot of script misuse or script fraud, I think one could say it. We have a term for this, pharming, P-H-A-R-M-I-G, which is the use of pharmaceuticals, the illicit use of them for narcotic reasons or for pleasure. Using those medicines. And so we've got a lot of proprietary medicines that people are taking to feel well. They're taking medicines to feel awake, to feel that they are able to go to work. We've heard about the dreadful unemployment statistics. People want to feel vital, they want to be productive, they want to be pain-free. So of course there's a great deal of taking of analgesic medicines, things like Grandpa, Panados, codeine-containing formulations. So South Africans do use a huge number of painkillers in order to feel pain-free and in order to work well and be productive and feel all right and enjoy their lives.
So would it be your contention then, having gone through all of this, that there is an increase then in over-the-counter self-medication?
It's very difficult to say, Jeremy, because it's incredibly difficult to get access to private databases on who is buying which medicines and how they are shifting through the supply chain, who is procuring them and then selling them on. We've seen, massive dysregulation, I suppose, or deregulation of the supplements market, for instance, that people don't have to prove the claims for the medicines that they're marketing and selling. We don't have, the strong Medicines Control Council, and the Mbeki regime was defanged, and we have a terrible backlog of medicines that need to be regulated and tested and then properly monitored. And yeah, it's kind of in some places pretty much a free for all. Whose job is that? Of course, it's the government's job, and they've got to be better about monitoring and regulating which pharmaceuticals are over the counter. But at the same time, we don't want to restrict access to essential medicines that really help people. So we don't want to force people to have to go and see a doctor, see a medical specialist. We have a terrible shortage of healthcare workers. So we want someone with a toothache in the sky to be able to go and get a tablet that's going to take away his toothache. But we also don't want teenagers to be abusing codeine, mixing it in with their Sprite, and having a long nap after break during maths class.
Fascinating insight live in Cape Town for us, Dr. Rebecca Hodes from the UCT AIDS and Society Research Unit.